Welcome to our July 2023 NAPA Council meeting. So for the Advisory Council on
Recording in progress.
Alzheimer's disease, research, care, and services. I'm Cindy Carlson. I'm the chair of our committee currently, and I'm looking forward to a very exciting day today. So we will be switching the order of our presentations today, but first we'll start with some introductions of council members. So again, we have a lot of exciting topics to cover today. So we'll be going through some exciting research updates from the Alzheimer's Association International Conference that was just held this July in Amsterdam. We'll be talking about some new exciting announcements about programs that will be available now moving forward. We'll be also presenting the recommendations from the committee members, the subcommittees, looking at the research, risk reduction, clinical care, and long-term support services for people living with dementia. So we have a lot of exciting topics to cover today. And again, we're going to be flexible and switch our order around. So to start off, we'll start with introductions, and then we'll move to talking about some of the research highlights from the Alzheimer's Association International Conference. So again, I'll start with our table members here. Maybe we can just go around the table. So Dr. Fontaine.
Good morning, everyone. My name is Sarah Fontaine, and I'm from the Congressionally Directed Medical Research Programs, and we're housed within the Department of Defense.
Good morning. My name is Erin Long. I am with the Administration for Community Living, and I manage ACL's Alzheimer's Dementia Programs Initiative.
Is this right on? Yeah, Matt Janicki. I'm with the University of Illinois at Chicago and also with the National Task Group on Intellectual Disabilities and Dementia Practices.
My name is Ken Kim. I work at a health center that serves mainly refugees and immigrants.
Good morning, everyone. I'm Rhonda Williams. I'm with Vermont Department of Health, Chronic Disease Prevention Chief, and I represent public health.
Good morning. I am Joanne Pike. I'm the president and CEO of the Alzheimer's Association.
Good morning. My name is Maria Ortega, and I work at Florida Atlantic University for the College of Nursing, and I am the chair of the Clinical Care Subcommittee.
Good morning. I'm Lisa McGuire. I'm from the Centers for Disease Control and Prevention in Atlanta, and at CDC, I oversee the Healthy Brain Initiative and the Building Our Largest Dementia Infrastructure projects.
Good morning and welcome, everybody. My name is Tisa Sherry, and I'm the Deputy Assistant Secretary for the Office of Behavioral Health, Disability, and Aging Policy in the Office of the Assistant Secretary for Planning and Evaluation, or ASPE, at HHS.
Good morning, everyone. I'm Helen Lamont. I work in ASPE in TISA's division, and I am the designated federal officer for this advisory council.
Good morning. I'm Dr. Randy Bateman, a neurologist from Washington University, St. Louis, and I am the chair of the research subcommittee.
Good morning. My name is Joe Monmany, and I am the individual on the council who's living with younger onset Alzheimer's.
Good morning. I'm Helen Bundy-Metzger, and I am the caregiver representative, one of two sitting on this council.
Good morning, all. Sherry Ling, Deputy Chief Medical Officer for the Centers for Medicare and Medicaid Services, representing CMS as a non-voting member.
Hi, Arlene Bierman, Agency for Healthcare Research and Quality. I'm the Chief Strategy Officer there.
Good morning, Dr. Julie Crowder. I'm with Indian Health Service. I'm the National Elder Care Consultant and the lead for our Alzheimer's program.
Thank you all so much. So again, we'll be moving to our updates from the AAIC meeting. And to start us off, we'll have Dr. Joanne Pike give us an overview of the meeting and some exciting statistics. So Dr. Pike, if you want to come up here, I think it'll be easier for our online audience to hear.
Thank you for the opportunity to talk a little bit about AAIC. And certainly it was an exciting year and one that hit some new records for us First off, in attendance. So for the first time in AAIC history, we had over 11,000 attendees, 11,261 participants in total. Over 7,500 of them were in Amsterdam with us in person. And then we had another 3,750 who joined us online. And that hybrid format for us has certainly, it launched with COVID-19, but it has become integral to where we continue to go into the future. So we will be maintaining that hybrid platform long into the future because we realize that it creates access to not just being able to see and receive, but also for participants who cannot be there, they are able to still present and participate in being a part of that conference. And one of the most important parts of one of those strategies that we have right now is also engagement throughout the world in bringing in some of that best-in-class science. And we had over 100 countries also represented in terms of researchers who were there on site. We had 600 podium presentations, 4,500 posters, and then something we are also very proud of is the fact that 62% of participants were women. 35 to 40% were also under the age of 35. So we're also seeing an increase in our early career investigators participating and having access to best-in-class science. And then the additional one last data point I would bring up is that 15 to 20% of participants were from low and middle income countries. Again, a very concerted effort by our team to make sure that they have the ability to present and access best-in-class science in the world. So the conference started with what has become fairly typical of us. It's the 6th annual NIA-AA Symposium on Enabling Precision Medicine for Alzheimer's Disease. So we had plenaries spanning multiple topics, including tau PET to the epidemiology of dementia in Africa, which was also a first to have a plenary speaker talking about Alzheimer's disease in Africa. We also had a special plenary on the downstream effect on biomarkers on anti-amyloid therapies. And then 2 highlights I know that we're going to hear from Randy and Cindy this morning are about 2 important topics that we had as plenaries as well. We had the donanemab session, which was attended by 3,000 people in the meeting room, and another 1,000 people streamed it live in that moment. And then we also presented the draft proposal for new Alzheimer's disease diagnostics criteria, which was presented and also opened for input. So I want to highlight this as an opportunity as we go through the revision of the 2018 NIA-AA research framework. It's available for public comment for 30 days from the point of that presentation, and that is at alz.org/NIA-AA, where you can review that and make comment on that diagnostic criteria. So with that, I'm going to turn it over to Cindy to talk a little bit more what I believe about that diagnostic criteria too. Thank you.
Thank you, Dr. Pike. In our flexibility and moving things around, I forgot to introduce my colleagues who are online, who are part of our panel as well. So I'd like to go through and I'll just ask each of you, I'll just go in the order of the boxes on the screen here. So Dr. Weiss, Joan Weiss.
Good morning. I'm Joan Weiss. I am the Deputy Director in the Division of Medicine and Dentistry at the Health Resources and Services Administration and the agency lead for geriatrics workforce enhancement and development. Thank you.
Thank you. Carrie Mulkey.
Good morning. My name is Carrie Mulkey. I'm the Director of the Bureau of Aging and Disability Resources within the Wisconsin Department of Health Services. I'm also the lead of the LTSS subcommittee. Good morning.
Thank you. Venerine Brown-Boatswain.
Good morning. My name is Venerine Brown-Boatswain, and I am the second of the 2 caretakers on this committee.
Thank you. And Rod Corriveau?
Oh, thank you. Rod Corriveau, a program director for AD/ADRD programs, NINDS.
And Robin Yee? Oh. All right, move to Amy Kelly.
Good morning. I'm Amy Kelly. I am the Deputy Director at the National Institute on Aging.
And Sarah Dodson?
Good morning, all. Sarah Dodson from NINDS Policy Office. Support Rod Corriveau and Dr. Koroshetz. Thanks.
Thank you. And Dr. Richard Hodes?
Good morning. Richard Hodes, Director of the National Institute on Aging. Good morning.
Thank you. Dr. Rebecca Farrell?
Good morning. I'm Rebecca Farrell. I'm at the National Science Foundation in the Social, Behavioral, and Economic Sciences Directorate.
Thank you. And Dr. Helen Blackwell. Ellen, I'm sorry.
Good morning. I'm Ellen Blackwell. I'm also with CMS.
Thank you. And Jim Rudolph?
Hi, Jim Rudolph. I'm a geriatric and palliative care physician. I work with the VA's Office of Geriatrics and Extended Care.
Thank you. And Melinda Kelly?
Good morning. I'm Melinda Kelly. I'm the Associate Director of the NIA.
Teresa Baracchio?
Hi, Teresa Baracchio. I'm Acting Director of the Office of Neuroscience within CEDAR at FDA.
Thank you. Scotty Hartram?
Hi there, Dr. Scotty Hartruff, Executive Director for the Department of Veterans Affairs, Office of Geriatrics and Extended Care. Thank you.
Cindy McConnell? Else? Did I miss any? Oh, we did Ms. Brown-Boatswain already. So, any other federal members that I missed or non-federal members? I apologize. Greg Link, I apologize. Greg Link? Right, yeah. All right, so we've heard part of our AAIC updates, but again, we're going to reshift back to our original plan. So I'm thrilled to introduce today our ASPE Senior Official, Miranda Lynch-Smith, who will be presenting and overseeing the presentation of some exciting news. Thank you.
Thank you so much, Dr. Carlson. Good morning, everyone. So good to see everybody here today. As Dr. Carlson said, my name is Miranda Lynch-Smith. I'm the senior official performing the duties of the Assistant Secretary for Planning and Evaluation. I'm also the Deputy Assistant Secretary for Human Services Policy in our office we call ASPE. I want to welcome all of the advisory council members here today, members of the public joining us for today's meeting, both those who are in the room and participating online. We are all here today, united by a shared purpose, to use every available and effective tool to address the public health crisis of dementia. Dementia impacts every facet of life of those diagnosed with the condition and also for their families, friends, and care partners. I know many of us have personal life experiences with dementia. I do too. My father lived with the disease for many years. My mother was his main caregiver. We had lots of supports that made our lives enriched as he struggled with this condition. This complex disease requires a comprehensive, bold, and coordinated response. 12 years ago, when Congress passed the National Alzheimer's Project Act, It created the critical infrastructure needed for such a response. Since then, ASME has had the privilege of overseeing implementation of this landmark legislation in partnership with the people here and many others. Through the National Plan to Address Alzheimer's Disease, which is updated every year, the federal government advances a coordinated strategy that addresses everything from research investments to improving clinical care and long-term services and supports for people with dementia, to supporting caregivers and advancing dementia risk reduction. This advisory council is essential to driving this work forward because you share with us your expertise and perspectives as researchers, as frontline healthcare providers, advocates, and people living with or caring for those with dementia. It is this incredible partnership, our shared purpose, and our collective action that has allowed us to accomplish so much over the past 12 years to support people with dementia. And we are excited to continue this important work together for the years to come. We have a very special accomplishment to celebrate today, and to tell you more about it, it is my great pleasure to introduce Chiquita Brooks-LaSure, the Administrator for the Centers for Medicare and Medicaid Services. Administrator.
Good morning, everyone. Thank you so much, Miranda, for that introduction. And I want to say and join you in just giving a special thank you to all members of the Advisory Council for Alzheimer's Research, Care, and Services. The work that you are doing is making an enormous difference and contribution in the lives of those with Alzheimer's and their families. And the comprehensive dementia care model test that we are announcing today would not have been possible without your continued input, support, and advocacy. I and the American people are very grateful. I want to start by thanking Dr. Liz Fowler, the CMS Deputy Administrator and Director of our Innovation Center, and the entire CMS Guide team for their extraordinary work to make this new model a reality and for helping to improve the lives of millions of people with dementia and their families. It is very important to me that the people who are served by our programs see that their needs are being addressed as part of our efforts at the Innovation Center, and this model certainly meets that goal. Unfortunately, Liz could not be here with us today, but she is truly excited about the positive potential of the guide model, and I see our CMS Innovation Center leads here in the audience today. I also want to thank Dr. Sherry Ling, our Deputy Chief Medical Officer, who has represented CMS on the Advisory Council for over a decade. She works hard to ensure that our policies and programs address the needs of those living with dementia, and she was a key player in the development of the model we are announcing today, as well as our broader work on dementia care. She and I have had many conversations about caregiving and thinking about the lives and the needs of people with dementia. We all know that few diagnoses are as devastating as dementia. The disease not only takes those who are living with it, but their loved ones who care for them on an incredibly complex and complicated healthcare journey, one that takes an enormous physical and emotional and financial toll. Just as Miranda said, so many of us are touched by dementia. I also, my grandmother had dementia for the last 10 years of her life, and it is incredibly, as we all know, difficult for the family. I remember so vividly when she couldn't even remember that she had just eaten her birthday cake, even though the empty plate was standing there, or looking at my father and saying, "You're too old to be my son," because she, her mind was where she was in her 40s and 50s. So I just say that to say I know how much and how personally vested I have been in looking at how we think as CMS about how we are incorporating caregivers in our work. Thanks to the National Plan to Address Alzheimer's, for which you, the Advisory Council, deserve much credit, we've made tremendous progress in improving care for people with dementia over the past decade. We've also been able to provide hope for those with Alzheimer's by ensuring they have access to new therapies, such as the new drugs that are coming to market, which Medicare now covers when a physician and a clinical team participate in a registry to collect data on how it works in the real world. But people living with dementia and their caregivers too often struggle to manage their health care and connect with key supports that allow them to remain in their homes and communities. We know that a large part of the problem is the current system of care for people with dementia can be very fragmented and siloed. This results in poor outcomes, duplicative and depersonalized services, and severe impacts on the quality of life for caregivers, who often provide significant amounts of assistance with personal care, finances, household management, clinical coordination, and other care. Additionally, fragmented care often leads to substantial financial burden, increased caregiving demands, and physical and mental strain for those caring for someone with dementia. That's why today at CMS, we are taking further action to further our commitment to provide high-quality health care and support individuals who are living with dementia, their caregivers, by announcing our new Guiding an Improved Dementia Experience, or GUIDE model, which will specifically help to address fragmented care by focusing on the integration of services. The model has three primary goals: to improve the quality of life for people with dementia, to reduce strain on their unpaid caregivers, and to help people remain in their homes and communities, preventing or delaying long-term nursing home placement. This is a visual depiction of our model, something I love for us to try to break down what we're doing in a way that is accessible to everyone. It is the first of its kind initiative for CMS, designed to support both those living with dementia and those caring for them. It also advances President Biden's landmark April 2023 executive order on increasing access to high-quality care and supporting caregivers, as well as the key goal for the national plan to address Alzheimer's disease. As I'm sure you know, for the President and Dr. Biden, caregiving and navigation of services are very personal to them as well. Specifically, the GUIDE model will include a sustainable alternative payment model that offers standardized dementia care, including assessments, care coordination, ongoing monitoring, medication management, and a 24/7 support line. A navigator will be assigned to create an individualized, comprehensive evaluation and care plan for a person with dementia and their family to ensure they have access to the right bundle of services. And the model will provide a link between the clinical healthcare system and community-based providers who can offer education and support, such as training programs on best practices for caring for a loved one with dementia. Additionally, caregivers will also be able to take a break from responsibilities by utilizing respite care for their loved ones at home, at adult daycare centers, or at a nursing facility for overnight stays. This new model will also help us advance health equity, which is a foundation for everything we're doing at CMS. Black, Hispanic, and Asian Americans, Native Hawaiians, and Pacific Islander populations have been particularly disadvantaged in receiving dementia care, even though they experience a higher prevalence of dementia, have more unmet needs, and spend a higher percentage of their family assets on care. The GUIDE model will help us to provide new resources to ensure greater access to specialty dementia care in underserved populations and communities, and therefore to support health equity. Dealing with the challenges of dementia care will never be easy, either for those living with the disease or their families. But our new GUIDE model is designed to best support those making this complicated and complex journey, offering comprehensive services and the best quality of life for all concerned, and greater hope every step of the way. It's now my pleasure to introduce 3 videos from members of Congress in support of our model. I want to thank the 3 members for joining us virtually, and as well as so many members of Congress who have given support to the fight for Alzheimer's disease and dementia care. I think these videos only highlight the truly bipartisan support for helping those with dementia, their unpaid caregivers, enjoy better health and better lives. And now I'd like to turn the podium back to Advisory Council Chair, Dr. Cynthia Carlson.
Thank you so much, Administrator Brooks-LaSure. We really are excited about this new guide model. And I was asked just to make a few comments as a clinician and as a researcher. Again, I think the thinking about these comprehensive care models really bring to light a lot of the things we've been hearing about over our council period of time for quite a long time. So the needs for greater coordination of care, the need for increased caregiver support, the need to help patients and families navigate this system. So again, my clinical care is within the VA healthcare system. Within that system, I see, good coordination within the VA, but I also serve as director of Wisconsin Alzheimer's Institute, which works with clinicians throughout our state in all kinds of different healthcare systems, and even with support from our Department of Health Services through a BOLD grant to try to integrate systems, integrate county-based services with clinicians. There's still a lot of gaps in our different communities. So the lack of resources, lack of adoption of care models, lack of coordinated care. So I think this type of move toward a guide model, implementing that on a larger scale, could have huge impacts. And again, I think we've all, as have been shared, a lot of us have personal histories and stories of dementia, and that's why most of us in this room are here. And so to be able to have caregivers, families, have someone to help guide them through the process, to get to the right clinicians, improve awareness, help them to reduce stigma, and helping them to tie in with their communities. And we recognize there's a lot of vulnerable communities that we work with, some with language barriers, some with different neurotypical presentations, some who have been in underserved areas for decades. So we're really thrilled with this. I know we started our AAIC exciting news, and we'll come back to that. We'll go back into our regular schedule, but even talking about exciting things like new medications and therapeutics, we realize that this is just a small part of dementia care for clinical care, and that the bigger part is making sure that we have a comprehensive care models that really serve patients and families well, and clinicians who are trying to do the right care. So thank you so much for presenting that. And now I'll turn it over to Helen Bundy-Metzger to share her perspective as a caregiver on what the guide model might do.
Thank you, Dr. Carlson, and thank you, Administrator LaSure. This is a day that comes after many, many years of advocacy. As my colleagues on the NAPA Advisory Council are aware, my advocacy stems from 35 years of direct family and community caregiving support of those living specifically with Lewy body dementia. I've been the primary caregiver for 2 of the 3 of my first-degree relatives that have succumbed to the disease. And over the course of those many years, the lack of wraparound care, services, and supports not only profoundly affected my loved ones, but my own physical, emotional, and financial well-being. The anguish that is shared with me by the many caregivers I continue to support only reinforces the desperation that encompasses families when the systems do not have the resources in place to address the multitude of needs they have. In addition, the significant loss of community-based adult day and adult day health programs over the past several years due to the lack of sustainable funding and a diminished workforce have placed untold additional burdens on these families. I have fought to see the day when healthcare and payer systems would more broadly recognize and address not only the physical, the cognitive, and the psychiatric symptoms, but all aspects of care and support that affect our daily quality of life. Because we live with dementia every single day, we know the need is critical. And now our struggles are finally being acknowledged. Here we are. I mean, I'm just stunned. I've had the benefit of the preview of reviewing what this program is going to offer. Not only improved quality of life for people living with dementia, but their caregivers, training, coordination of care, reducing the burden on us and the families, and preventing, this is critical because it increases CMS's costs, is long-term care placement, whether it be hospitalization, admissions to emergency rooms, or long-term placement in skilled nursing, and then loss of assets and qualification then falling under Medicaid. So I'd like to just kind of shift and share something in the last few days. A few days I commented on an in-depth interview done by the BBC, which gathered experts to provide their perspectives on the new disease-modifying therapies, both lecanemab and donanemab. I compared this period to Advent, which in the Christian faith is a period of anticipation awaiting a birth. But it signifies the beginning of a new cycle, not the end. As we know, the work towards a cure is not done. The goal is not fully attained. Well, today we have lit a second candle, and we will anxiously await the outcome. It will take further study and broad dissemination and implementation of the best practices adapted to meet the needs of our diverse populations and regions. But we have taken our first major step to see that across this mighty nation, families who live with dementia every single day can seek and find the care, services, and supports necessary to navigate this challenging journey. Thank you.
Thank you so much, Helen, for giving that perspective. And I just want to say again, just thank you to all of you for your leadership and your work on behalf of all of the families who are both suffering from dementia and Alzheimer's disease, but also their caregivers. And I want to say again, a huge thank you to our team for doing so much to try to make sure that we were listening to the community and incorporating the perspectives into the model. And so I will now turn it back over to all of you for the rest of your meeting. Thanks again for having us.
Thank you again, Administrator Brooks-LaSure. We are so thrilled about this. We know that there's a lot of hard work that went into development of this guide model. So we would like to invite our colleagues from CMMI Innovation to come up to the front here, and we'll ask some questions. So I'll turn it over to Dr. Tisa Marie Sherry to moderate this section.
Thank you so much, and a huge thank you to our CMMI colleagues for joining. Let me open it up to questions, starting with the Advisory Council members. Do any of you have any questions you'd like to pose to our colleagues from the Innovation Center? Dr. Pike.
Not a question, just a big thank you on behalf of the Alzheimer's Association for taking the time to implement this thoughtfully and in a way that will have significant impact on communities and our constituents.
You also helped a lot making sure that we could hear from a lot of direct caregivers and beneficiaries, so we really appreciate that. I don't know, Tanya or Emily, if you have anything else. Go ahead.
Living with the disease. Thank you. And looking at this, I just see the value it could have offered me when I was diagnosed. And I know that I've spoken with probably hundreds of people that experienced something very similar to what I went through. But after I got my diagnosis from my neurologist, he was so focused on treating the disease, but he actually did virtually nothing to deal with how to address me dealing with having the disease, that I probably spent 2 years just trying to figure out how to get my life under control, where to go for help, how to get information, who could help me, that it was just spinning. And I was just talking to Helen earlier, where she had a friend, a professional like I was, who you'd think they would know what to do. But it's amazing how when you suddenly have your life turned upside down, you're just trying to get grounded. So having something like this will have somebody take you through the process, who can help you, guide you, get you the information, the assistance. It's just invaluable to, it's going to be thousands of people who need that and don't know where to go. And I just look forward to helping you get the word out, because I'm so excited about what this can offer people. It's needed, and it's very exciting. So thank you.
Yeah, thank you for your comments. And we heard from a lot of beneficiaries and caregivers a similar story, that they were just lost, not really knowing what to do. And so we're very hopeful that the word will be spread and that there will be more programs implemented across the country. Thank you.
Just let us know how we can help.
Absolutely. We will do that.
I was about to say, you'll definitely be hearing from us.
Yes.
Oh, Carrie Mulkey, go ahead.
Awesome. Thank you. Thank you so much. So I just want to express too my gratitude. As the chair of the LTSS subcommittee for the last 4 years, and I guess as I am kind of finalizing my tenure here on the council, I just feel like so many of the recommendations that were a part of our set of recommendations is really showing up in this new initiative. So really appreciate, I feel listened, I feel like the work of so many of these council members, it was worth it. So really, really excited to learn more about what's all entailed. But again, I'm feeling much gratitude for what you've done here. Thank you.
Thank you for that. And I should mention that there will be a webinar on August 10th. Where there will be a lot more detail presented then. So appreciate everybody's participation in that and spreading the word. Thanks.
Cindy.
Thank you again. One question I had, I know that there's been in the overall model, there'll be more of a focus on health equity. Could you talk a little bit about what are the elements that make this really appropriate for improving health equity?
Yeah, so we have a number of policies in the model that are focused on improving health equity. One of those is having what we are calling a new program track, so support, technical assistance, in some cases for safety net providers, and infrastructure payment to support developing new programs with organizations that are serving underserved populations. So trying to really make sure that we are supporting and bringing in those organizations to be able to provide support to those communities. We'll also have expanded data collection activities, so collecting data on sociodemographic variables, health-related social needs, to be able to incorporate that into our evaluation of the model, to identify disparities, make sure that we're developing policies to address them. And then also a health equity plan requirement. So organizations who are participating will be required on an annual basis to put together a health equity plan, identifying strategies for improving equity, reducing disparities, and then tracking their progress towards those goals over time.
I see that Venerine Brown-Boatswain has her hand up, and then we'll go to you, Helen. Thank you.
I wasn't clear from the presentation in terms of where will this be happening? Is that in a certain state or throughout the country? And what type of training will these navigators have?
So I'm going to give a quick summary of what the CMS Innovation Center does and then turn it over to the guide team to talk a little bit more about that. But the CMS Innovation Center essentially has the authority, that's a really good question, has the authority to test new ways of providing care to beneficiaries with a goal of improving care in Medicare and Medicaid. And so essentially we're what we call testing this model. So this will not be national. It will only be in areas where we have providers that are partnering with us to do it. And Tanya, do you want to talk a little bit more about how that will work?
Yes, so it'll be open to anyone across the country to participate, but the way that it'll work is that providers who meet the eligibility requirements will apply to participate in the model, and they'll have to follow the rules and requirements of the model to participate. But through this test, we do hope we will capture many providers throughout the country to participate, and then they will reach out to beneficiaries and caregivers to let them know that they're participating in the model, and we'll support that outreach as well. Does that help answer your question?
Helen, go ahead.
Hi there. I had a question because I'm actually aware that the model you are putting together has looked to models that have been studied over the past several years. And I actually happened to be part of a dyad in one of those care models and actually sat on the advisory council that advised in the early stages. So I'm just wondering, I know that one of your criteria will be 24/7 access to provider. And how is that going to be defined? Will it be MD? Will it be people, licensed? What are your requirements for that?
We're hearing from online audiences. If everyone can make sure they speak closely to the microphone. Thank you.
Yeah, so one thing I will say is we have quite detailed care delivery requirements within the model, and there will be more detail available on all of those requirements in some of our materials online. And our request for applications, which will be available in fall 2023, will include a lot more detail on those recommendations. But in general, that requirement is for access to a member of the care team. So someone who is part of the organization and has a relationship with the beneficiary and caregiver already. Or we do allow some flexibility for that to be a third-party organization that the participant is contracting with to provide those services. And we recognize that this can be a challenging requirement for organizations. So again, being conscious of enabling safety net providers to participate, providers with less resources to support that requirement, having some flexibility in being able to meet that requirement.
Julie Crowder.
This sounds really exciting. Thank you so much. I'm curious if you anticipate or how you might anticipate opportunities for rural and frontier providers to participate, since they have a lot of unique circumstances and resource constraints.
So a lot of the care delivery services will be able to be delivered through telehealth, which we are hoping will help encourage rural health providers to participate in the model and be able to serve their beneficiaries. Did you want to
Yoon Kim?
So what's going to be measured as the success criteria that makes it different than other programs like the other programs you've had before? That's the first. And second, what's being different about this program in approach to those who don't speak the language, limited English proficient community members, refugees, and immigrants?
I can address the first question, then I'll turn it over. Sure. I can address the first question, then I'll turn it over to the team. So the CMS Innovation Center can test new models, and they're very rigorously evaluated. And we generally look for a reference population of similar folks in the community and try to compare them and see what the difference is. In terms of if this model does achieve our intended outcomes, the Innovation Center has the ability to expand then the model test nationally. So that would be sort of what makes it different, is that in Medicare, this could be part of a permanent model if we achieve the outcomes that we've defined in the test. Do you want to talk a little bit about underserved communities and outcomes?
Sure. So 3 key goals that we are tracking to for this model are to improve beneficiary quality of life, reduce caregiver strain, which I think is a huge differential factor for this model. It's something we've never done before, is measure caregiver strain. And then also we're looking to reduce long-term nursing home placement. So I would say those are probably our 3 key factors of success. But as Ellen said, we will do a rigorous evaluation, and we will likely have other factors of success as part of these programs as well. I think that answered your question, but okay.
I know that Joe has another question. After that, I think we have time for a couple more questions, and then I'm going to give our CMS colleagues a chance to add any final thoughts they have or any other kind of important messages that we haven't been able to cover. Joe, go ahead.
Thank you very much, Lisa. So, Tanya, I wanted to circle back to a comment you made about the program's here to get more providers engaged in the program that you guys are offering. But from what I understand, many providers, right now are focused on what they get paid to do. And like, I'm guessing my provider was focused on what he did because that's what he was incentivized to do. How is this payment model going to change to provide an incentive to provide the care under this comprehensive model that's different to encourage them to want to participate in this program?
Sure. So I can answer that at a high level. And then as I said, there'll be more details on the webinar, but there will be a dementia care management payment for services, the care delivery services that are required as part of this model, including caregiver support and education, as well as care navigation services and linkages to support services in the community by community-based providers. And so we're encouraging new providers to participate in the model through this monthly management payment. And then in addition, there will be a respite payment for the providers to coordinate or work with respite care providers and provide those services so that caregivers can get a break and take care of their own healthcare needs and other tasks. Yeah, thank you.
Any other questions from our advisory council members?
Just a clarifying question. Will you also be tracking the caregivers' health through the program? And will that be one of the outcomes that you'll be looking, given that caregiver burden is a major impact on health and causes depression?
It's a really great question. We will be tracking caregivers' strain using the Zarit Burden Index. So it's a validated tool to measure caregiver strain. In terms of other health outcomes, it is out of the scope of this model, though we are hopeful that having the reduced caregiver strain would, help impact and improve healthcare of those caregivers. Yeah.
All right, Matthew Janicki gets the last question.
Thank you. I have sort of a rounding up question, I guess. Can you give us a sense of the N in terms of your initial demonstration? How much of an impact is that going to have in terms of the population, the states, and the geographic dispersal? Can you kind of give us a flavor of that?
Well, I think as Tanya alluded to, this is a voluntary model. So providers are voluntarily going to partner with us and receive the monthly payment so that they essentially are reimbursed for those services, those additional services that they are providing. I think we all hope that there will be many, many providers that want to participate. But we do have a number that we have to meet in terms of availability. And that's relatively low, but I think we're hoping that there'll be broad participation.
No further. Yes. I think we're not ready to share what that number is.
Thank you all so much. To our CMS Innovation Center colleagues, are there any final remarks or clarifications that you would like to offer?
Just thank you to everyone here. I know many of you were really instrumental in helping us do this. And, I think this is ultimately about the Medicare beneficiary and the caregiver and thinking about how we do this better and provide better care and outcomes. Many, many folks that we talk to have personal experiences with dementia. And I think we can all agree that the current system doesn't always work as we think would be optimal. So really hopeful that this model will be able to change care for these beneficiaries.
I just want to take the time to shout out to my team. I came to CMMI about 9 months ago. So this is new. It's the first thing that I worked on at CMMI. I absolutely would not have been able to accomplish any of this. And lots of it started well before my time without Emily Johnson, who is our wonderful, brilliant model lead. And we also in the room have Jennifer Brown, who has been leading our quality strategy, and Charlotte Kay, who is relatively new to our team, but has been working on our payment policies. And then virtually, we have several other members of the team, Sage Hart, Serena Ho. I'm going to forget other names now that I've started down this path, but the entire guide team, and then also the CMMI Innovation Center. And this group, both federal advisors and many of you stakeholders in the room that have made this model possible. So thank you.
Wonderful. Thank you all so much. Thank you to our CMS colleagues for leading the charge with this incredible work. And thank you so much to our Innovation Center colleagues for taking the time to come and answer our questions today.
All right, we are going to move back to our original agenda, although the time will be shifted. So next we'll be talking about some more updates in dementia care. Is that correct? And then we'll be going ahead and moving. Okay, so we'll be moving to the federal agency updates. And then following that, we will finish up our discussion about AAIC updates. So I'll turn it over to Helen to introduce Tisa. Dr. Sherry, to introduce the federal agency updates. Thank you.
I'll just sit here. Hello, everybody. Well, you already just heard a very significant federal agency update. And as tremendous as that was, believe it or not, we have others to share today. Really looking forward to, some other stellar announcements from our federal colleagues. Just kind of before we jump into it, kind of stepping back and putting, all of this together, just as, we're just in a very, very exciting time, with the availability of new therapeutics, the accelerating pace of scientific progress, on addressing Alzheimer's disease and related dementias, initiatives such as the guide model to try to help put together also all of the policy and infrastructure and payment pieces that we need to help those succeed. Just as there is so much enthusiasm and hope amongst the people we've talked to in the scientific and clinical communities, among people living with the disease and their caregivers, similarly, we have that level of enthusiasm, hope, and commitment amongst our federal partners who are here today working on this. While we are so thrilled with these accomplishments, we are not resting on our laurels. This is driving us to work harder than ever to continue to build on this significant progress. I think the guide model demonstrates how important coordinated federal investments that are informed by diverse stakeholders can make a difference and can achieve positive change. And we're very grateful that the National Alzheimer's Project Act, this advisory council, and the national plan have afforded us the support in the vehicle to really foster this incredible collaboration and drive these innovative new care models forward. Within just the past several months, there has been, an unprecedented reinvigoration of federal investments and federal commitment to really address the needs of people living with Alzheimer's disease. That focus will only continue with the president's emphasis on meeting the needs of the care economy through the executive order. And we look forward to reinvigorating and continuing this work going forward in partnership with all of you. And with that, over to our federal colleagues who I thank so much for their tremendous expertise and leadership on these topics. First, we will hear from the Administration for Community Living.
Well, it's kind of hard to be the guy that follows up after that CMS announcement. So, I'm Erin Long. I'm from ACL, and I'm just going to give you a few quick updates on what we're doing across our agency. The next slide is just wanted to share with you our recent announcement of 12 new grants to community-based entities. You'll see that it's pretty broadly based across the country. We're super excited to get new state entities involved in our programming, and their grants started in July. So I got the project period, but they've already started working, and we will look forward to positive results from them. For the next slide, I'm just going to give you a couple of opportunities that are coming. We do have an opportunity that's available right now for another round of the same programs for states and communities. and the applications are due August 7th. We're optimistic that we will get some additional applications and programs funded before the end of the fiscal year. I will go to the next slide, but we do have another, or never mind. So this is just a snapshot of the types of organizations, the diverse populations that where we're serving people right now. We actually have 29 states in Puerto Rico. We have programs active in 29 states in Puerto Rico. Since 2014, we have served in 44 states in Puerto Rico. We have a broad range of organizations that we fund. So if you know anybody that is looking to serve people in the community or in their states, you just send them our way. The next slide, please. So we do also, through ACL, have some other upcoming awards. Applications were received for the National Alzheimer's Call Center. They expect the new grant awards to be starting around, the grant, it's a single award, around September 1st. We also have some new awards coming from ACL's Lifespan Respite Program. And those awards will be coming hopefully later this week. There is an exciting, you may be familiar with ACL's Community Care Corps. It's working with models to support local models to engage volunteers, providing non-medical assistance. They give small mini grants to help encourage volunteer programs, and mini grants from those they solicit applications, and then they are giving awards in 2020 or September 2023. So that's a 5-year grant program that's been going quite well. Next slide, please. So we do have, you guys hear about it. Those who come often hear often that we have a series of webinars that we do, 10 webinars each year. We do have one coming up working with one of our grantees in North Carolina, helping families navigate the dementia journey. They have an amazing caregiver college that they operate through the Maya Angelou Health Equity Caregiver College, the Maya Angelou Center for Health Equity Caregiver College. And it's been particularly successful, and we are going to have them talking about their program. And then we also in September have the Intertribal Council of Arizona talking about the program we funded, where they're delivering dementia-capable, powerful, cool tools for caregiving, and Walk With Me, which is a music and memory program that they worked with the Banner Alzheimer's Institute to develop a culturally competent version of a music program to support caregivers and people living with dementia. Next slide. So just a couple of things we've done recently. We had Dr. Schmitz joined ACL in May for an amazing webinar to help our aging network understand how to get to VA and get services to people. It was really well attended, and we are very appreciative of VA partnering with us to make that happen. We also worked with, in June, we had a webinar on the converging of age-friendly and dementia-capable health systems, working with one of the health systems that we've funded in Maine, and the John A. Hartford Foundation talked about the age-friendly program. And those are both going to be, we record all of our webinars, and they're available on the ACL, NADRC, National Alzheimer's and Dementia Resource Center website. Next slide, please. So I'm not going to go through it, just a couple of resources. One of the cool things that we do in our program is all of the resources that are developed through our grants nothing is proprietary, so we make everything available to the broader community. And so these are just a couple more resources that we've developed. We have our advanced planning guides and highlights of resources, so it's sort of a menu of some of the better stuff that's been developed and posted on our website. Next slide. ACL in June of 2021 created a program called Commit to Connect that was designed to increase the availability of programs and strategies to address social isolation and loneliness. They have been working on this for quite some time, creating a nationwide network of champions, and they have created a website, excuse me, that that's connecting people, and they're doing communities of practice, and they are coming up very soon with their topical. They're creating topical guides on a variety of programs or variety of issues connected to social isolation and loneliness, and they have one coming up soon that's on social connection for people living with dementia. Next slide, please. So the National Institute on Disability, Independent Living, Rehabilitation Research, much easier to call them NIDLR, has been funding some work out of Cornell and their ENHANCE program, Enhancing Neurocognitive Health Abilities Network and Community Engagement Center. And I'm not going to go through the various things that they've talked about here, but they're creating studies and papers to advance the work of that program. And I think I have one more slide. So ACL is home to the Assistive Technology Program, ACT-funded programs, and we just wanted to highlight two of the assistive technology programs that have a small focus on Alzheimer's. The North Dakota Assistive has partnered with the Alzheimer's Association of North Dakota to create a Alzheimer's ambassador for assistive technology program, and they are picking up their activity in relation to sending people out they created these sort of boxes full of a variety of assistive technology tools to support people in the community, and they go to health fairs to show those assistive technology tools and build awareness. And then the Connecticut Assistive Technology is also partnering with the association to engage in outreach and awareness and the utility of assistive technology for caregivers and people living with dementia. And I think that's it. I just wanted to add one thing. On Friday, I got my slides in before we were able to get a forecast out we have a new forecast for a new program at ACL for innovations in dementia-specific respite care. So we hope that the announcement will come out in the next couple weeks. The forecast is there. It's $5 million for a 5-year period, and it will be a grant program similar to our community care core. So $4 million to innovations in respite and $1 million to doing the administrative stuff that comes with putting together a grant program. So we're excited about that, and that's all I have.
All right, over to Arlene Bierman from the Agency for Healthcare Research and Quality.
Great. So I think I had one. Yeah. So I just wanted to make people aware of a report that ARC released very recently on optimizing health and function as we age. We held a roundtable where we invited people representing multiple sectors: public health, social services, communities, professional societies. And while this is on healthcare for older adults writ large, it's, I think, very relevant to this group, and it's great going after Erin. A couple of points is that, most people living, with Alzheimer's and related dementias also have multiple chronic conditions. So we also have to tackle the challenge of presenting, delivering person-centered care that deals with all of their healthcare needs, as well as, social context. The other thing we heard loud and clear was there's so much innovation going on around the country. So if there's ways that we could bring together that innovation to accelerate our learning. And the other thing is that, most clinicians don't know about all the wonderful work that Erin just talked about. So really making those linkages across the federal government and all of our programs to really optimize the experience and delivery of care to improve health outcomes. So that, that's all I really had to say today. And, it was great to hear all the things you're doing, Erin.
All right, over to Lisa McGuire from CDC.
Great, thank you so much. Next slide, please. So I have a few updates that I'm going to share with you as well. So the first one is we have refreshed and redesigned our website. The website launch went live in early July, so please check it out. Next slide. I was hoping, like Erin, to be able to go show you a list of funded BOLD programs, but at this point, I cannot share that with you. All I can say is it's coming really, really, really soon. We are going through some of the legal stepwise process to make sure everything is set with those. I can tell you it will be a lot more than the 23 that were funded previously. So we are extremely excited and lots of good things to share with you soon on that. Next slide. So before I've told you a little bit about our Healthy Brain Resource Center, but what I want to make sure is that you do check out the Healthy Brain Resource Center periodically. We have over 300 materials that are publicly available that we've either identified or our vendor has identified, and they have gone through a review to look, make sure that they're credible and usable, and that they do meet our criteria for integrity. The point I wanted to bring out or show you with the slide is where those arrows are. Please, please, please send us information. We would be glad to think through and look at the materials that you provided, and we want to keep this resource growing moving forward. Next slide. One of the new neat features of the Healthy Brain Resource Center is we now have a searchable resource for Alzheimer's disease and related dementia plans. So these are the plans that are available on our website are the most current available ones for that jurisdiction. You can click on the map and get to the plans, or you can actually go ahead and search for those. So once again, if we don't have the right plan up for you, please send it to us and we will revise and put what is your most current plan on there. Or if you're one of those states that's missing a plan and we've missed it, please, please let us know, because one of those is my home state. Next slide, please. I wanted to share with you a really exciting publication. Some of the names of the authors on here you'll recognize, especially if you've been coming to the advisory council meeting for a while. What this paper does is it really outlines the process and the contents for getting Goal 6 turned into action and included in the national plan. You can see that our Helen Lamont is listed as an author, as well as the previous advisory council co-chairs, Katie Brandt and Dr. Alan Levy. So this is an open access article, so please, please download. We've made sure it's free and available to the public. Next slide, please. We hosted a very successful first National Summit for Alzheimer's disease risk reduction. That was in May in Atlanta. Our auditorium was full. We had a bunch of online attendees, and what I'm wanting to share with you today, the recordings are available. So those are available, and so please, please share those with your colleagues. And if you weren't able to listen in person or online, it's there for you as well. Next slide. This slide I'll just say very briefly because Dr. Joanne Pike and I are going to talk about this in detail a little bit more. But one of the biggest accomplishments for us was the development and launch of the Healthy Brain Initiative Roadmap, the fourth in this series. And we'll tell you all about it in a little bit. So thank you very much. And I'll turn over to my colleagues. Oh, we are going straight to it? Oh, okay.
Sorry, everybody seems very flexible today. We have a few special presentations mixed in with the federal updates. As you can tell, we're going to continue that theme the rest of the morning.
Okay. I guess I'm starting too, Joanne. So I got to moving. All right. Well, that was really good timing. Okay, so today I'm going to share with you a little bit about the Healthy Brain Initiative Roadmap for the state and local public health. So this is the fourth in the series. We launched it at the end of June. We're real excited to say that we have had over 1,500 downloads of the document so far, And we've had a very successful launch webinar, which had over 800 participants in it. Next slide. So I'm Lisa McGuire, and I served as the co-chair for the steering committee.
And I am Joanne Pike. I'm the CEO of the Alzheimer's Association, and I'm pinch hitting for the other co-chair of the steering committee, who is Kristen Clifford, our Chief Program Officer.
Next slide, please.
Our motto for the Healthy Brain Initiative roadmap was everyone deserves a life with the healthiest brain possible. And I think as we reflect and think about even the stories we hear, whether it's personal for you, for another member of the council, or for a member of your family, we know that this motto and framework is truly setting us forward from an organizational standpoint, but also from a public health standpoint with this pure framework in mind. We have the best resources and knowledge that we have today built into this framework. And you're going to see some new things, but certainly some things that are going to look familiar from previous roadmaps as well. Next slide. As we mentioned, the roadmap just released last month. There is going to be some time to do a deep dive into each of these areas. But for objectives for today's conversation, we're really going to look at the need for public health action. What is going on in communities now around Alzheimer's disease and other dementia? What is the life course approach that this roadmap is using? What's new? What is different? What are the collective outcomes that are being recommended and the collateral materials that will be available soon? And then we'll have some time for Q&A as well. Now, this slide certainly for all of us is pretty second nature. It's a timeline and looking at what are we looking at from now until 2050 in terms of the cost and also the prevalence. We also know that this prevalence model is based on what we've known historically for risk factors. Now, I mention that because the prevalence based on risk factors that we know today is very different than the prevalence for risk factors on the population that exists today. If you think about diabetes and obesity alone, our projections today are probably underestimated given the population that we are seeing now and how that relates to 2050. Next slide.
So I'm going to share with you a little bit about the public health impacts and how our new BOLD awardees, as well as anyone else, can utilize this roadmap for public health action. Next slide, please. So this slide is illustrating the life course of dementia, and this is a new graphic for us. So I'm going to break up the graphic and talk about each component of it, but just so you can see where we're going, this is the overall with it. So next slide, please. So one of the first changes that we made to this graphic is we added in more phases or more stages into the purple graphic. And this was a suggestion of the Alzheimer's Association's early stage advisory group. And it really helps us, I think, get a better representation of what we see going on in the processes. Next slide. So from a public health perspective, one of the big things or one of the big themes that you'll see with the roadmap is you'll see a lot of that, where can public health intervene? So we think about it from primary prevention, secondary prevention, and tertiary prevention. And so you'll see the language here, primary prevention, but within our space, that is what we term risk reduction within the Alzheimer's dementia space. So we can see here with the risk reduction phase, we can see with the bars or the people that are shaded darker, we can see that when we're looking at risk reduction, we're seeing that it's not just in that pre-symptomatic phase. We can see that there are benefits for engaging in those healthy lifestyle behaviors throughout really most of the dementia process, because we're going to be able to help potentially prevent other conditions or help manage the conditions even better. Next slide. So with early detection and diagnosis, or what we refer to as that secondary prevention, what we know is it's really important to keep raising awareness. And we know that diagnosis is extremely important, especially with a lot of those advancements that came out of AAIC and some of the announcements we've been hearing recently. But the thing is, we want to know that diagnosis is important regardless of where it does come in that disease process. We want to have people to have diagnosis as early as possible, but we want to make sure that people do get them throughout the process. Next slide, please. So we're going to move on to tertiary prevention. So what were the main issues that we're thinking about with tertiary prevention is safety and quality of care, and this also includes caregiving. So within this component, as soon as those cognitive issues are diagnosed and detected, we know that there are things that can be done to improve the safety and quality of life of not only the person who was diagnosed, but also the people and the family members that are providing support for them. So it's really important that we not only think about the person with the diagnosis, but also at the same time thinking of the person who's supporting them and also providing care to them. Next slide, please. So we went through and we looked at the various segments of this graphic, but now we can look at it again all together. So within each of these sections with primary, secondary, and tertiary, we can see where those courses of prevention or those points of intervention really have the most impact or could have the most impact along the disease process. And we're not just focusing on older adults. So one of the things that I think you'll see from our recent paper that was published, as well as the Risk Reduction Committee, we are focusing on thinking about risk reduction and starting earlier and earlier with that. Next slide, please. So really what we're thinking about is that life course approach. So this life course approach, as I showed, shows you those opportunities of intervention and those opportunities of intervention across the life course as well as the disease process. So with the development of this roadmap, I want to say this was an 18-month process. So this was not something that we just got in our conference room one day and threw together a bunch of actions and recommendations. There was a steering committee, there were work groups, there were lots of meetings, lots of deliberative thought and attention to everything that was included in this roadmap moving forward. We had representation from state, local public health, we had academics, we had medical communities, we had, you name it, we had a variety of different folks involved. So we actually had about over 100 individuals that were involved in the development and the review of the content. We wanted to make sure that we were focusing on the most recent scientific evidence, as well as we wanted to make sure we had that strong commitment to really looking at decreasing those risk factors. Next slide, please.
So as you heard Lisa mention, this is the fourth iteration of the roadmap. And you might be thinking to yourself, what is in here that wasn't covered in the first three? So let's talk about what's new really quickly. And there's three main areas that are new within this roadmap. And the first one is partnerships. So there's a significant increased emphasis on community partnerships. And in fact, the domains were reordered so that partnership and community coalitions, developing coalitions, is number one. Certainly addressing brain health will take an all-hands approach so that roadmap reflects the need for community and essential action by public health in communities. The second new area is really how fully integrated health equity is within this roadmap. It is much more explicitly called out with both a chapter in the front of the book as well as equity elements throughout all of the actions. So that equity as central to development process was a core focus of one of our work groups, as well as a central point within all of the work groups. And certainly, since it has its own chapter on equity and social determinants of health, it has increased focus, and there's also more information within the glossary on this area as well. Then third, evaluation. And how can we measure the impact of the roadmap? So this roadmap includes for the first time standardized set of outcomes. There will be an evaluation tool for the roadmap that comes out later this fall that will go through specific ways health departments can measure against these outcomes. And nationally, the Alzheimer's Association is committed to evaluating the impact of the roadmap also. In addition to the outcomes, the actions within the M domain, measurement domain, on data collection as well as data translation and sharing findings with partners is core within some of the work that we're recommending for health departments as well. Next slide. And it wouldn't be a new roadmap without a new graphic. And what we have here is a look at how are we putting together each of these new domains, but also making sure that the central focus of health equity is right there in the middle. What you'll see is this is an adaptation from the previous roadmap frameworks, certainly updated with the order of the domains, but also that health equity is in the center of this roadmap. The outer ring also shows the areas of practice that are the focus of the actions within the roadmap, and those loosely align with the work groups that we had that developed actions against those. So just to call out where we're at, we have health equity in the center, and then around that health equity is partnerships and policies, measurement and evaluation and utilizing data, diverse and skilled workforce, and engaging and educating the public. And surrounding that is risk reduction, early detection and diagnosis, caregiving, and community and clinical linkages as well. Next slide for Lisa.
So within those 4 domains, this time around, there are 24 action items. And as Joanne mentioned, within each of those domains, for the first time, we have added the outcomes. So this slide is showing you the outcomes for strengthening partnership and policies. So really, this has been a strong emphasis, especially when we think about how public health departments operate on. Traditionally, we're very good at connecting and convening people and building those partnerships and relationships. And we know that's how things get done. And so we really are wanting to come up with ways to measure that impact as well. Also, another really important thing, if we think about too with risk reduction, is really integrating the brain health messaging with other chronic disease efforts. And then at the same time, we know sometimes it takes policy action to really facilitate that implementation within jurisdictions. Next slide, please. And then this is the measure, evaluate. And the key here is that utilize the data. So for outcomes, we really are focusing on increasing not only that data availability and quality, but also the utilization of it. Data is not that useful or useful at all if you just collect it and let it sit. We need to be able to look at it, think about what it means, and utilize it. And then with the second outcome, they really be able to use it for helping to decide on some of our decisions that we're going to make and some of the actions that we decide to take. So in other words, where do you start? One way to do it is to look at the data and see where the biggest deficiencies are, or go to wherever that, quote, low-hanging fruit might be. Next slide, please. The third domain is that diverse and skilled workforce. Really here, the outcomes that we're looking for is trying to reduce stigma and bias about cognitive decline in general, and at the same time, increasing the knowledge and skills of the current and also future workforce. You'll see here we kept the language broad, because when we're thinking about workforce, we're thinking about it as broadly as you can imagine, from the diagnostic workforce to the occupational therapy workforce to the dentist, the various types of allied health professionals that a person might interact with. Next slide. So engage and educate the public. So this is really trying to focus on that public knowledge about brain health, risk factors related to dementia, and also really the benefits of that early detection and diagnosis. And then also by raising that knowledge, we're hoping that one of the outcomes that we will see is increased use of services for people living with dementia and also their caregivers. All right. Next slide. This is me, right? Yeah. Okay. So some other things that you will see in here is one of the best ways that we found that our BOLD recipients, as well as other public health departments we've worked with, is we learn by example. We like to see what others have been able to do, whether there's small tasks that they've achieved that's been very meaningful and important in their jurisdiction, and also sometimes even how they've leveraged and braided funding and resources from multiple organizations. We'll see in this version, we see from the various health departments that are represented. Some of those health departments are around this table. We also have examples from local health departments as well. So please check those out. Next slide. So there are a couple resources in addition to the actual roadmap. We do not have the hard copies of the roadmap today, but that is available on both of our websites, free downloadable, so please check it out. But we do have a couple handouts. Advisory council members, you should have these at your seat, and those that are here watching and listening, they're in the back. We have first the executive summary. The favorite thing of the executive summary for me is always the back side of the executive summary, because it has all 24 of the action items, one single place. They're right there listed by domain. The other item that's on the back of the table is what Joanne highlighted, the what's new. So it tells you what the new features are in Roadmap 4, because there are some, even though we've done it, this is the 4th time we've done it. And on the back is our wheel of domains. And you can see that, and also the explanation of what's going on in those wheels of domains. Next slide.
So just to highlight, I know Lisa just mentioned we don't have hard copies yet, but those will be available in the fall, and you can order them online once they are available. And also, we hope to be able to announce the next round of BOLD awardees soon enough. And there will be certainly some more tools available as we begin the process of rolling this out, including an implementation guide, topic-specific resources, and evaluation tools. So please sign up for email updates so that you will know when those hard copies are available if you want to order them. And that is available on the link there. Thank you. Next slide. And I think we're ready for Q&A if there is any.
Would you like to do that now? Okay. And let me just add too, if you want copies and you'd like a box, like 50 or more, please request that, because we will glad to help you with that. So any questions? Okay. Go ahead, Arden.
Yeah, so this is really exciting. I have a question. The Trust for America's Health is working with a number of states on age-friendly public health systems. And are those two initiatives linked at all, or can they be?
Yes, they can be. And actually, one of our BOLD awardees also has funding for the age-friendly, and they've been very, very successful at being able to braid that funding as well. And Trust for America's Health was also represented on our steering committee and helped in the development of this roadmap. So we are trying to be as complementary to each other as we can. Yes, sir.
So the whole process is exciting, and I've been part of it, so I can speak from the inside. But I also want to point out that the meeting at the GSA, which is coming up in Tampa in November, will be focusing also on what you call the component P projects, which are looking at the diverse populations that are involved in this roadmap. So I want to draw attention to the fact that there is very strong interest in ensuring that anyone can focus in also on what's going to happen with the roadmap, with its applications to those populations. So I don't know if you want to make a comment about that, but that's...
Yes, I will. Thank you, Matt, for that reminder. So what Matt is talking about is at the Gerontological Society of America meeting in November in Tampa, we have a pre-conference workshop in the afternoon. I don't remember what day it is, but we have the afternoon session. But what it will be is, Matt mentioned the B, so our Healthy Brain Initiative, B awardees, which are the population focused on American Indian Alaska Natives, African American, Hispanic adults, and adults with intellectual and developmental disabilities. That will be the focus of that workshop, and how to tailor the roadmap actions in this roadmap to those specific audiences. Okay. Any other? Yes, Sherry.
Hi. Thank you so much for this work. Also very excited and supportive. In the spirit of, building on other relationships and partnerships, I do wonder how and what might be the opportunities to connect in the Million Hearts approach, because this is something we have, it's the same people at the points of care that we want to not only improve using the same type of interventions, by the way, on heart health, kidney health, brain health. So how do we enable that kind of synergy to happen? Because I think all in all, the people who benefit will then enjoy the additional optimization of health outcomes. So food for thought for you, but also very supportive. So thank you.
Well, thank you. And I will say at our risk reduction summit that was in Atlanta, Million Hearts did come and gave a wonderful presentation. And so we are working on some collaborations with CDC's Division of Heart Disease and Stroke. So they're kicking off some new awards as well that I'm not allowed to say how many or who as well. And they're making sure that there's going to be some integration between their awardees and our awardees as well, too, because we recognize that, what's good for that one organ is good for the other ones as well, too. And we are also working with National Association of Chronic Disease Directors and a couple of medical organizations.
No, I think actually even that's called out specifically, Sherry, in our risk reduction recommendations. You may recall is in there. So just as a preamble to our recommendations this afternoon.
Yes.
So that was exactly similar to what I was thinking. And you have it here, increased integration with other chronic disease efforts. It would be great to have an example, for example, whether integration with Million Hearts or hypertension, pre-diabetes, diabetes management. There's a lot of things that are shared for prevention purpose. If you manage your, the health, nutrition, there's going to be so many things that are common. So any example of how it's going to be integrated with other disease management?
Great question. So I'd encourage you to go to our website, cdc.gov/aging, and we have a series of materials. So we have one that we did with ASTO and IA Squared that's talking about healthy heart, healthy brain, and there's some materials that are customizable for those were designed for American Indian, Alaska Native adults. We also have some materials with National Associations of Chronic Disease Directors. We have a series of RAC cards, which looks at a variety of those different major risk factors. And those are also customizable. So you can take them and put your organization's logo on them for free. All right, next slide. And you may have to, okay, this should be the video. Is there a bar at the bottom? There you go. Whoops. Uh-oh. Hang on a second. It's a wonderful video. It is worth the wait. The music is very nice.
No, that's not.
Had an overwhelmingly positive effect on population wellness. As a result, people are living longer in communities all over the country. But as the size of the U.S. population, age 65 and older, continues to grow, so too will the number and proportion of Americans with cognitive decline and dementia. Just as with other chronic conditions, the best way to reduce risk for the greatest number of people is to act now. The updated Healthy Brain Initiative Roadmap is a framework designed to help public health professionals lead with urgency and act for impact in their communities. with practical guidance and strategies that align with existing public health efforts to mobilize community partnerships, prioritize and pursue health equity, and focus on measuring results. Through public health, we can improve brain health across the life course, enhance policies and systems to reduce the risk of cognitive decline, expand access to early detection and diagnosis, improve safety and quality of care for people living with dementia, and attend to caregivers' health and well-being. Together, we can accelerate progress for brain health in all communities and reduce the risk and impact of dementia throughout society.
Helen?
Okay. I just want to be sure I'm not feeding back here on the other
You don't want
mic.
to echo?
Okay. No, I had a question as I see this, and I love the video, by the way. I just wanted to be certain, how is this going to be rolled out to the general public? I mean, are you working with media groups? However you can get it out there, because organizations pushing it forward is only one aspect. People have to be able to access those organizations. We need to have it in the public face.
I'll let you go ahead on that.
Yeah. Well, let me just start with, I think that's one of the main reasons why partnership is front and center on that. The main kind of dissemination channel is certainly the public health agencies across the country, whether city, county, and state. However, it requires partnerships with those organizations on the ground level to make sure constituents hear about this as well. And that's a big piece to why that coalition building is right up top. Anything that you want to add to that?
Well, this is definitely something our Bold awardees will be working on as well, too. But it's amazing, like we give out we'll be giving out more Bold awardees this time. I had to stop myself before I said the number. But it's amazing how much work goes on that we don't fund. And it is just exciting it's exciting, but at the same time, those folks are using the roadmap to help guide what's going on in their jurisdiction, even if they didn't apply for one of our awards. We wish we had enough money, and at some point maybe we will, and staff to fund everyone. But it's good that those who want to do something or their legislature wants them to do something, this is a framework that they can start with. And I just will also make a plug that if somebody is doing work out there that's not affiliated with CDC, you still have access to all of our resources, our Bold Public Health Centers of Excellence on risk reduction, caregiving, early detection, and diagnosis, because they are a resource to the nation, not just to the Bold awardees. Thank you very much.
Thank you all.
Produced by the U.S. Department of Health and Human Services.